So the FDA has now authorized for emergency use while they are still evaluating a full approval of the Pfizer COVID-19 vaccine. The Pfizer COVID shot has been approved under emergency use for 12 to 15-year-olds. Remember that J&J and Moderna shots currently approved 18 plus. Pfizer was already 16 plus. Now it is 12 plus. This is a great bit of news because there are 17 million 12 to 15-year-olds in the United States. That represents about 5-6% of the total population. And that is a significant chunk, particularly when we think about students being back in school, many already, and almost a certainty that they will be going back to school in person in the fall. Being able to make eligible an additional 5 or 6% of the total population is a really great thing. This has been widely tested. We know that the vaccine is essentially 100% effective at preventing serious disease and death in 12 to 15-year-olds. It triggers a robust antibody response. And there's a recent survey from the Kaiser Family Foundation's Vaccine Monitor, which found that many parents, even those who have themselves been vaccinated, are reluctant to vaccinate their adolescent kids, sort of in that 12 to 16, 12 to 17 range. It's really important that that happens for several reasons, not the least of which is that going back to school without vaccinated kids just doesn't pass the sniff test. It just doesn't make logical sense. And we are expecting vaccination for 12 to 15-year-olds to start this week. Appointments, at least in some states, already being open to 12 to 15-year-olds as soon as tomorrow, as soon as Friday. And we are going to see, likely as we saw with the adult vaccination, an initial surge and then probably a tapering off. And that's fine. Just, every time we get new eligibility, let's get as many people as we can vaccinated. And then over the summer, as schools say, in order to come back on campus, you're going to need a vaccine. You're going to see more and more people in that age range go and get that vaccine. States, counties, and school districts around the country, per the New York Times, are trying to figure out the most reassuring way to reach those younger adolescents as well as their parents. In most states, parents have to consent to 12 to 15-year-olds being vaccinated. And so it will be not just the 12 to 15-year-olds who need to want to get the shot. It will also have to be the parents, which makes sense in most cases. And there are plans to offer the vaccines not only in schools, but also at pediatricians' offices, day camps, parks, beaches. And we're increasingly hearing about even some restaurants in some cases getting involved in the vaccine effort. So, there's no question. I've been seeing on Facebook anecdotally people saying, my kid is not getting any shot. They're not getting anything experimental. There will be that. There is that in every single group. That's going to decline as 12 to 15-year-olds start to get vaccinated and overwhelmingly start not to get the virus because the vaccine works so well. Certainly, schools requiring vaccines for in-person attendance are going to further increase the number of parents who will say, well, I wasn't big on it, but I've got to get these kids out of the house. I mean, quite frankly, it's sort of a silly thing to say, to think about it in those terms, but that is going to be a factor as well. And there are going to be all sorts of mobile vaccination initiatives and plans to just make it as easy as possible for 12 to 15-year-olds to get vaccinated. So I continue to say that by Memorial Day, a lot of these numbers are going to look significantly better. We expected them to start looking better in mid-May, and they are. We just went over that. Cases are now down 84%. Deaths are now down 81%. And there is still, I think there's a couple things going on. There's still a lot of doom and gloomers who are only focusing on the negatives. And there are negatives. 650 deaths a day, while down 81% from the peak, is still a lot. But in the more vaccinated states, you are starting to see the daily deaths get down to and even below the number of daily deaths you typically see in a flu season. That is very good news. And there is no question at this point that we are able to vaccinate our way out of this. So if you have kids in the 12 to 15 age range, I would love to hear from you. How are you thinking of this new emergency use approval on 12 to 15. If you are vaccinated, but you don't plan to have your kids get the vaccine, let me know why. I'd be curious to hear from you, and we'll have more about the vaccination effort on the show's Instagram page. Make sure you're following us there at David Pakman Show, and make sure you're following me on Instagram as well at david.pakman. We'll take a quick break. We will talk about the latest COVID lab leak conspiracies. Dr. Fauci was confronted by Rand Paul. Or maybe Rand Paul was confronted by Dr. Fauci. I don't know exactly. We'll have to look at the video and decide for ourselves. That'll be after this short break, and much more upcoming. One of our sponsors is Vincero Watches, giving you 15% off. A high-quality wristwatch is the perfect way to elevate your style. Own at least one watch that makes you feel great when you put it on. You can often see me wearing my Vincero watch on the show. Mine is the gunmetal vessel model. I'm a big fan of the metallic look of the face of the watch. I like the silicone strap. You won't find a better made watch for this good a price anywhere else. When you put it on, you know you got more than you paid for. Vincero believes in crafting super quality watches from high-end materials, but selling them at fair prices, which is why they have over 26,000 five-star reviews. And they stand behind every watch they make with a 1-year return policy and 5-year warranty. They'll give you 15% off everything in their store and free shipping at davidpakman.com/watch. Use the coupon code PAKMAN